Men's health has been in the spotlight this week, highlighting the importance of prevention and early detection of disease amongst men. The biggest threat to men's well-being is their mental health. Of the 8 people who take their lives every day in Australia, 6 of them are male. Yet men are far less likely to seek help than women. The Banksia Project is working to destigmatise men's mental health in regional communities and was one of the finalists in the Men's Health Forum. Jack Jones from the Banksia Project joins us now. Jack, thank you so much for coming in.
Thanks for having me.
So, those stats we just talked about then, the biggest threat to men's health is actually their mental health, and it's affecting an extraordinary number of men. What are the figures?
Look, it's pretty tough. 80% of suicides a day in Australia are men, and then 82 men actually call 000 every day seeking help with their mental health. So the stats are pretty harsh, and the challenge is that men in Australia don't necessarily know how to ask for help and where to ask for help.
So the landscape of mental health is changing. We know that men are more likely to speak up than they would have been, say, 10 years ago, and they're more comfortable with being vulnerable and sharing their feelings, but there's still a long way to go. Where are we at with men's attitudes towards their mental health?
Look, I think it's changing massively, and it is good. There's a lot more awareness around, but the practical skills are still not always there. Men don't necessarily know how to ask. They don't always have the literacy on who to ask and where to ask, and then having that safe space and then practicing the conversation. Our programs have been amazing. Just looking at the data, providing that safe space for men to actually talk, they've tripled their outcomes in terms of health, well-being, resilience, purpose. The outcomes are massive, so just providing that safe space has gone a long way.
Yeah, I want to hear more about what you're doing with the Banksia Project, because you are, as you say, having amazing results getting men to open up, and especially in regional communities where it can be even tougher for men to do that. They face more of a stigma, don't they, in those areas? So how do you go about breaking that down and getting them to feel comfortable about talking?
Yeah, great question. It's a really tough one, but it's really good that we work hard at that. We have 2 main programs. So we've got a garden room. It's an open forum of about 300 people in the room to talk about an issue at hand. So we've got one next week in Sydney, for example, managing mental health and financial stress. From those open forums, we engage men into an ongoing program. So men meet about 2 hours once a month, called a growth room. They learn to support each other. They're vulnerable, honest about how they feel, and then they also learn some really practical skills. You know, how important it is to diet or to have good hygiene, to sleep well, things like that go beyond that first step. And then they also just practice that conversation. It's a peer-led and peer-run community group.
Yeah, so I know the focus at the Banksia Project is that peer-to-peer contact, as you say. Why is that less confronting for a lot of these men than, say, going to see a professional?
Look, there's some great strength behind it. I think it's really important that it's mates for mates and blokes supporting blokes. What Banksia do that's a little bit different is, rather than providing an external facilitator, whether that's a community member or a professional, we actually train the community to support each other. That goes a long way. They're the experts of their experience, so it's really good that they understand what each other are going through and they can support each other through that. The other thing that we do is we provide clinical support. So if any of our community volunteers that we train to run our programs, we actually provide them with clinical support, so they've got very clear referral pathways. If someone is struggling with a bit more of a challenge, they're straight into that professional help.
The emphasis with your organisation, I know, is very much on prevention. So you're trying to get to the problem before it becomes a crisis. How do you do that? At what point do you need to interject to stop that happening?
Absolutely. I think it's really important. Our programs are for everyone. Everyone has mental health, and it's really important to identify that people need to work hard to stay mentally fit and healthy. Our programs provide a space to do that, so they can learn some really practical skills that when crisis arises, and it does for everyone, they've got the tools in place. They know exactly what to do. They've already had that tough conversation with one of their loved ones, or they know how important it is to, you know, eat well, sleep well, those sorts of things. Some really practical skills, and if they learn them once a month, they then go and become accountable to each other and try and implement them twice a month, 3 times a month. And as I said, the data in our programs is just amazing. We just need to now get this scaled to all places.
You talk a lot about the importance of men opening up and sharing with others, and in your case it's the peer-to-peer contact. Why does that have such an impact, particularly on men, when they do share where they're at mentally?
Yeah, I think it's really important that men give other men permission to be vulnerable. I truly think the best way in doing that is by being vulnerable yourself. it then says to other people in the room, you know what, I'm okay. I've struggled at times, I've gotten through that, and I'm okay. And it's amazing to see that once someone breaks that ice, everyone else in the room says, you know what, there are times that I struggle too, and there are times that I need help. And so when that arises, they're more than comfortable doing so.
And have you seen some pretty amazing results in the rooms?
It's absolutely
when this goes
amazing.
on?
You know, sometimes I've seen people come in with their hood up and their hat down and crying for about 2 hours straight, and these are grown men. And then I get a message the next day of a sunrise run saying, we can do this. So it's truly amazing, and I'm the lucky one that gets to see it every day.
And that's what keeps you going.
It is. Makes it very easy.
Oh, it sounds extraordinary. Jack, thank you for all the impact you're having on men's mental health, and thanks for sharing that with us tonight.
Thanks for having me.